Hello and thank you for joining us on World Now. We begin here in Nigeria, where a national state engagement on HIV sustainability has taken place to ensure an effective and efficient disease response driven by local and partner leadership, ownership and financial independence. Experts believe this approach will be one step closer to eliminating the HIV by the year 2030. TVC News' Kemi Balogun has the details.
Nigeria has made some progress in the HIV and AIDS response through an improvement in testing and treatment services for new infections and mother-to-child transmission of the disease. But experts say more still needs to be done. In 2023, Nigeria still recorded 45,000 new infections. To chart a new course for the HIV response in the country, the issue of sustainability is now on the front burner of discussions here.
We cannot do it alone. It cannot be done at the national level. We have to cascade this down to the state level. And over the years, a lot of parallel structures are in place, for the programs, a lot of vertical programs.
The agenda is to find solutions of improving sustainability on financing, local production of commodities, and also effective data gathering.
So in this conversation, making sure that the political leadership at the state level, it's important. I'm talking about governors, but I'm also talking about chairman of the LGAs. It is important that we look at our programmatic sustainability, which is ensuring that, so government institutions, the communities are involved in the implementation.
We cannot be talking about ownership and sustainability and importing more than 90% of what we do, the drugs, the reagents, and the test kits, all those things. We must produce condoms. We must try as much as possible to produce them in Nigeria, so that if we are talking about sustainability. Then health financing. I look at health financing that health insurance is a key, is the future.
And part of the sustainability is ensuring domestic resource mobilization, because of course financial program is very essential. Unfortunately, as we speak, most of the funding is driven by donors, but now we are talking about ensuring the necessary budgetary allocation, both at the federal government level, at the state level, and even at the local government level.
Nigeria remains on course to achieve the 2030 target of 95% of Nigerians living with HIV expected to know their status through testing services, 95% of all those with diagnosed HIV infection be captured in sustained antiretroviral therapy, and 95% of all people receiving antiretroviral therapy will have attained viral suppression. Kemi Balogun, TVC News, Abuja.
And joining us live to talk more about this is founder Love for Health organization, Dr. Yusuf Harun. Good afternoon.
Good afternoon.
Yes, is HIV increasing or decreasing in the world, and especially Nigeria? Let's take it off from there.
Over the past decade, between 5 to 10 years ago, the prevalence of HIV in Nigeria in particular and the world in general has reduced significantly. According to the UN AIDS 2021 study or survey proved or showed that HIV/AIDS in Nigeria reduced by 21%, which is very significant. Although the burden of HIV treatment has increased, this has a good side and a bad side.
All right, so what do you think doctors and healthcare professionals have done to reduce its spread in Nigeria?
Very important thing the doctors and the healthcare professionals have done is health counseling, health education. Many people are aware of HIV now, unlike 10, 20 years ago. The commonest mode of transmission, doctors have advised people, especially the patients, is to practice safe sex, which is a means of transmission, which could be oral, anal, or also vaginal sex. One should make use of a protective covering like a condom. Also, doctors have advised that people should prevent using multiple or infected needles, which can transmit the virus. Also, a woman who has HIV/AIDS or HIV, she should try to prevent this transmission to her baby by taking heart, seeing a doctor, and going through some safe practices, preventing breastfeeding, probably having a cesarean section instead of a normal vaginal delivery, which could increase the chances of a child. This goal in Nigeria has reduced the transmission from the mother to child to less than 5%, which is very significant.
Now, let's quickly talk about the countries that have the highest, incidence of HIV. And what do you think, in what way do you think they've been able to tackle this the pandemic, and how have they been so successful in doing this?
Unfortunately, the top countries on the list are African countries. It's also sad to know that these African countries, majority of them are from South African region. What I mean is South Africa, Mozambique, Botswana, Namibia, Zambia. These countries top the list of HIV. For example, in South Africa alone, 9.2 million people are living with HIV. Nigeria has a high number of HIV population in West Africa, and it's topping in West Africa. But looking at our population, according to statistics, about 156,000 new people got the HIV. But compared to South Africa and other Southern African countries, their incidence is higher, and we should do something to reduce the burden.
Okay, so let's really talk about your recommendations to those with HIV and AIDS. I mean, how can they live long, and then how do they manage or handle the issue of stigmatization?
Number one, we should avoid stigmatization. There are about 10 major disease conditions in the world that have been stigmatized. HIV is one of them. People should stop looking down at people with HIV. It's not everyone with this disease or infection that contacted it through a promiscuous means. A child could contact HIV even just through an infected needle or blood transfusion. I have seen a patient, a sickle cell patient, who contacted HIV, and she has never had any sexual contact in her life, but it was a fault from the hospital which transfused an HIV-infected blood into her. So another thing is counseling. People should be counseled, go to a doctor, go to a health practitioner to counsel you. Also, let us always work together with people with HIV/AIDS. They are humans like us, and they should make sure they use their antiretroviral drugs. Health practitioners, let us make sure we put on protective covering like gloves, and we should try and all reduce the transmission of HIV. Let's transmit love, not HIV. Thank you.
All right, thanks indeed for your time, Dr. Yusuf Harun, founder of Love for Health organization. Moving on, with just half a month to